Hello, welcome back to Perspectives in Child Maltreatment. This is Chapter 2. We'll be talking about risk factors. Specifically, we will look at parental related risk factors. So the question that we have to ask in child maltreatment is, why does child abuse happen? It would be nice if we could say it happens because of X. So if X is true, then abuse will occur. If that were the case, then we could simply focus all of our energy on preventing X. And if X was not possible, was not there, then we would know the child's safe. But because no one single factor causes child abuse and child maltreatment, then we can't say that one factor causes it. What we actually see are risk factors. When you see the presence of many risk factors, you see a greater likelihood of abuse. And even when the risk factors are there, we still don't necessarily know, we can't say that abuse has happened. So poverty, for instance, when we see high rates of poverty, we see high rates of abuse, but that doesn't mean that every child raised in poverty will be abused. And a better way of looking at this is in a systems approach. So for instance, let's use Bronfenbrenner's ecological model. Well, if you take a look at this model, this helps us understand that human behavior has many levels. All of your actions are really an intersection of broader systems at play. If you think of your own life, you have your own individual factors such as your own age, your health, your medical history, your sex. Now, that would be your own individual. Immediately outside of you would be what Bronfenbrenner called the microsystem. So you live in a household with your family. You go to a school where you find your peers. You have attending physicians and your primary care physicians. You have a church that you go to. You have sporting teams. Now, beyond the microsystem, you have the exosystem, just friends, a family, mass media. And then you have a mesosystem, which is the interaction between the exosystem and the microsystem. And even beyond the exosystem is the macrosystem, which is the ideologies and the attitudes of the time. So let's apply this to child abuse. We see that children, boys, females of different ages are at various risks just because of those demographics. Younger children are exposed to a certain level of risk that older children aren't, and vice versa. And we look at age factors as we interact with the individual and the microsystem. Children are suspected of abuse in families. They are suspected to be abused sometimes in the school, through church groups. We know the religious communities are no stranger to abuse and to abuse allegations. So obviously not every child in every family is abused, and not every child in every church group is abused, and not every child that plays Little League sports is abused, but we know that there are interactions that can be abusive. And we also have to keep in mind the chronosystem, the time in which the child is living, the socio-historical conditions, the time since life events. So that everything that's conspired in a child's life. Children right now are living in the context of the coronavirus. So my son, who is 4, soon to be 5, has now been in 2 different school years, calendar academic school years, where the coronavirus has been a factor. Living in a different chronosystem, I was raised with no thought of a pandemic when I was his age. And so it's good to see the ecological perspective, Brofenbrenner's model, to lay the groundwork that when we see risk factors, we're looking at the intersection of all these different systems, and just introducing this model will help us as we discuss these matters moving forward. Okay, so what are some parental family risk factors? So, single parenthood, especially when we see single parents that do not have lots of family support. We see lots of children in this area of the country in the South who have a single mom, but perhaps they spend a lot of time at their grandparents, right? Perhaps they live right next to their grandparents. So their mom lives in a trailer next to her parents' house. And although she's a single mom, the family has lots of access with grandparents. What we see is that the more isolated the single parent, the more vulnerable the child is. Also, harsh parenting maltreatment. We live in the South with a lot of families practicing corporal punishment. However, there's also a threshold here. The worse it gets, the more harsh the parenting, then more likelihood the maltreatment. A lot of family disorganization, low parental monitoring, what the scholars refer to as free-range kids. Free-range kids are those who don't have a lot of access, don't have a lot of parental oversight. Parents are not monitoring their phones. Caregivers and guardians are not monitoring their internet usage. They're not monitoring their movements. And free-range kids seem to have the run of the house in the neighborhoods. Kids who are at great risk for abuse also are socially isolated. They have a lack of support, a lack of interaction with other levels of related systems. So when we see high risk or risk factors for abuse, we see that parent has an insecure adult attachment pattern. Now, if you've taken general psychology, perhaps you remember Mary Ainsworth's attachment research. Mary Ainsworth did formative work in the field of psychology around the area of attachment theory. And what this essentially speaks to is our ability to form relationships later in life is impacted by our relationship to our mother. And what the child maltreatment literature indicates is that parents who don't have a strong attachment, so these are parents who, for whatever reason, didn't click with their mom, moving forward, they're at a higher risk for maltreating and abusing their kids. We look at parental mental health factors. These include depression, low self-esteem, substance abuse, emotional instability, poor impulse control. So McCoy and Keene outline these not as predeterminants of abuse, right? So just because a mother has depression, just because a mother has low self-esteem or a history of substance abuse does not necessarily mean that they always will abuse children. But what we see is that they are at higher probability. There are certain dynamics of depression that lend themselves to poor parenting or difficulty in parenting, and we will explain this more. So specifically, when we look at the risk factors of domestic violence, this is one of those adverse childhood experiences, along with high parental conflict. And we're quick to note that a child who sees their parents physically engaged in high conflict marriages are not necessarily better off than or worse off than divorced families. What we mean is parental conflict is damaging across the board. It becomes increasingly problematic when we see it tied in with these other risk factors, such as parental psychopathology, substance abuse, parental illness, death of a parent or sibling, and even foster care placement. Other parental risk factors would include the parental sex. We see women charged with neglect, in 86% of neglect cases, women are the ones charged. In child abuse cases, specifically physical abuse, 62% of the cases are attributed to men. In sexual abuse cases, 87% of cases are attributed to men. So we do know that sexual abuse occurs with women. Women do abuse children. However, 87% of those cases, men are the ones who are perpetrators. Parental substance abuse is also a risk factor. It's associated with all types of maltreatment. Substance abuse would include alcohol and drugs. Specifically, substance abuse is more closely associated with neglect. Substance abuse is featured in 2/3 of all child maltreatment cases. And specifically, abuse history increases likelihood a parent will commit maltreatment. So when we have a history of alcohol or drug abuse in the past, this exponentially increases likelihood of maltreatment. And we can talk about this more. There's a variety of factors, and it may vary depending on the type of substance that was abused. But there are long-standing consequences to child abuse. In my psychology classes, I talk about the effects of cocaine use. Cocaine is associated with dopamine. So cocaine serves to replace dopamine levels in the brain. And after a person stops using cocaine, the brain's ability to have normative levels of dopamine, that's impaired, inhibited. So a parent who is sober and recovered from cocaine use will not smile. Dopamine is associated with happiness. So this parent may not be as physically and emotionally present as they need to be at best case. Now, at worst case, they may have been severely damaged and severely impaired because of their past drug use, and the children may suffer. So again, when you're in the field in your future career, teaching, coaching, whether this be being a youth minister or being a little league coach, whatever it may be, just because a family has a history of drug use and substance abuse, we have to be careful not to superimpose our value system. It's not necessarily the case that these children are being abused. However, it does elevate risk. Cocaine using mothers have been researched. When researched, women who have used cocaine, some attempted to shield their children, so they were actively using, actively addicted, and were cognizant enough to attempt to shield their children. However, at the very least, the money they spent towards drugs was not spent clothing their children, feeding their children. So the kids may have had sufficient clothing to get on the bus and go to school, but they might have struggled to get the clothes that they deserve, the clothes they needed to really feel warm and to feel safe. Right, so Kearney, Murphy, and Rosenbaum, 1994, they're cited in McCoy and Keene, have just said that drugs oftentimes take food, like the money the parents using for cocaine could very well have provided better nourishing food. So the children perhaps are eating boxed cereal with no milk when they could be eating more nutrient-rich foods. Substance abuse also affects disinhibition, which means substance abuse can take away the parent's sense of a red flag, all right, or this may not be the best idea, kind of impaired judgment because of substance abuse for many years. We have a human trafficking documentary that I oftentimes show in my on-ground classes, my face-to-face classes. And in this documentary, one of the human trafficking victims said that crack cocaine is a gateway to human trafficking, meaning when parents are actively using crack cocaine, there is a strong connection with parents who will eventually prostitute their children out, and over many years becoming strongly connected to an addiction takes away and impairs judgment and impairs the ability to parent. And that's why substance abuse is such a risk factor for children. And just so that you know, this is not an isolated incident. I was talking in a class about this documentary. This was a general psychology class, and I talked about the relationship between drug use and human trafficking. Someone becomes addicted, they start selling, but then eventually they start, they can't find enough funds for their habit because their habits will cost more from year to year. They begin prostituting themselves, but they still crave more drugs. They can't get enough drugs. So in time, they may even resort to selling and prostituting their children to aim more money. And then also in some cases will intentionally get their own children to be addicted to cocaine, expose them to drugs so that they can produce and provide funding for their habit. And if this sounds so shocking, and if it sounds so abnormal, we do need to remember it happens far more than we would like to think. I was in a class, I was sharing this, and after the class, I'll never forget, I had a student walk up to me and tell me, "You just told my story." It's very heart-wrenching. It's very heartbreaking to realize that this does happen, that drugs can actively cause parents to need the substance so badly that they do things they otherwise would not. Other risk factors would include mental health issues, parental mental health issues. So depression, for instance. Depression features lack of interest. People who are depressed, they sleep more than usual. They eat more or less than usual, and they have issues in terms of their mood. They feel despondent. They feel disinterested and even hopeless. And so this is a direct connection to their parenting. But we don't parent as well when we're not getting rest. We don't parent as well when we're not taking care of our own physical needs. We see even things such as weight loss. Right? Children may lose more weight if the parents are neglecting their needs and if they're depressed. We see sleeping problems on behalf of the parents, on the part of the parents, problems concentrating, Mothers with depression are at a higher risk for child maltreatment because they are less involved with their kids and they show less affection. So when depressed mothers are compared with mothers who are not depressed, the women who are depressed will actually hug their kids less and will show less attention to them. In addition, we see psychosis. Psychosis is a mental disorder that's marked by loss of contact with reality. So I tell my children, my students in class that people with schizophrenia are marked by delusions and hallucinations. The analogy I use in my classroom, if you see little green aliens coming out of the vent in the classroom, that's a hallucination. If you believe the little green aliens are coming out of the vent, then that's a delusion. One study found that 53% of a sample of women had delusions about their children. 53%. Delusions of persecution occur when the parents feel as though someone is out to get them. And if parents feel like someone is out to get them, they may actually overparent their child. They're going to overprotect them. They're going to be hyper cautious. And these children may not be maltreated. However, when we see delusions of paranoia, this oftentimes produced child abuse in the 2006 study by the authors mentioned here. So when parents with paranoid schizophrenia are scared, they're hearing voices, command hallucinations, and delusions. They may even begin to think the child is evil. The hallucinations are particularly damaging and particularly high risk. Other risk factors for child maltreatment would be personality issues. Most abusers do not have a mental illness. They are more likely to feel inadequate and impulsive. So we would say that parents who feel inadequate, parents who are impulsive can cause problems. They can be violent, can struggle with low self-esteem, immaturity. They may have a low frustration tolerance, and they may have anxiety. And it could simply be that parents are not prepared for kids. Maltreating families are often ill-prepared. They lack basic caregiving skills such as food prep and house cleaning. Neglecting parents know less about children and child development. This can lead to unrealistic expectations about what children should be and what children should be able to do for themselves. So the maltreating parent may simply have unrealistic expectations. Right, the child should be able to not soil themselves. Right, little kids are going to wet their diapers. They're going to soil their diapers. The younger a mom is, the more at risk child is. The less education the mother has, the greater risk the child is in. And in 1,400 cases of maltreatment, the mother's age at the time of birth best predicted maltreatment. The younger, the greater the risk. Now, the pictures that are in this slideshow were taken at Mississippi's Child Advocacy Training Institute. So the picture you see here was taken at the Institute in something of a virtual tour that you will be seeing throughout the class. This is not a real gun. This is designed to look like a real gun. It is for the purposes of training. And what you see here is a dog kennel. And so this is used for training social workers, law enforcement agents, and they are taken through and they are given the task of identifying things that should not be in the home. Obviously, a gun should not be within reach of a child, as is the case. But other things that may not be as obvious. Things like jump ropes can be a choking hazard. You will see this cage in other pictures. But young parents are 3 times more likely to maltreat their children, and oftentimes because they may not know what is a choking hazard. If a child is 14, 15 when they become pregnant, 16 when they give birth to the child, they may not have the wealth of knowledge. They're not even finished with high school. So they may not know what toys are inappropriate, that are not age appropriate. Uneducated parents are 5 times more likely to maltreat their children. Individuals who complete school before they have children minimize their risk. So simply finishing out your education, getting your college education, and even a master's degree, it decreases the chance that you will be poor. It really does. The more education a person has, the greater likelihood they have of living in a middle class income or greater. And things like income are connected with abuse. When we see lower income levels, lower education levels, we see risk factors for abuse go up. So this is a negative correlation. So in terms of the intergenerational transmission of abuse, you see that experience of child maltreatment increases the likelihood that one will abuse their child, but it does not determine, right? So predetermination is not the case, so it's not inevitable, but these factors are very real. So take a look at this dog kennel. Here you have a dog kennel that is used for training purposes. It says Jonah lives here. This is a child. There's all kinds of problems. The aforementioned gun that's here. There's also a plastic bag in the kennel. And this is kind of taken from real life cases. Social workers go out on calls and they see things like this. And it's important in a child advocacy course such as this that we prepare students that we do have children in Mississippi and around the world and even in the United States that are treated terribly. And just because someone is uneducated does not mean that they will treat their children like this. Just because a person was young, and just because they're a single mother does not mean that they will necessarily abuse their children. But understanding these risk factors helps us investigate, it helps us ask the right questions. So I tell my student that predisposition is not predetermination. Being abused as a child does increase likelihood of abusing children, but it does not determine. So it's important that students know this. I've had students that have overcome these kind of adverse childhood experiences. So I'm mindful to share their success stories with my current students. Here you have a picture of a chair with an extension cord that is used to restrain children in mock cast training. Obviously, we do not restrain children with extension cords or dog kennels. In fact, that's abusive. We need to eradicate that kind of parental strategy. So we do tell folks in our class that we need to be mindful. You could go out on a call and see something like this, right? You may just walk past a chair with an extension cord and they may give you some bogus story about why it's there. But you need to ask that extra question or two. Family structure and function also are things that we need to ask for when assessing for child maltreatment. Single parents, domestic violence, large family size, poor family functioning, and poor educational support. Does this family live in a school district that is a low quality, where there's not tutoring, where there's not exceptional or even average educational resources? Maltreating families report less togetherness, less communication, fewer positive interactions, lower level of verbal exchange within the family. Family roles were less clear, less flexible, difficulty coping with change. And single parents elevated risk. Domestic violence. Having two parents does not guarantee safety. 10 million children witness domestic violence each year, and some of these happen within married families. Children may be hurt when attempting to stop the domestic violence. Psychological harm takes place when children witness violence. It can create aggression, anxiety, low self-esteem, academic difficulties, stress. Risk factors would include prematurity. So premature children are at a higher risk. Birth anomalies place children at higher risk. Exposure to toxins in utero, chronic or serious illness. Temperament affects this. Developmental, cognitive disabilities, low intelligence, and antisocial peer group. All of these things would elevate risk factors. Lack of access to medical care, health insurance, social services, parental unemployment, homelessness, inadequate child care, exposure to racism and discrimination. We also see that poor schools, frequently changing residents in schools, exposure to environmental toxins, dangerous neighborhoods, community violence, exposure to media violence. All of these things are at a high comorbidity, right, with child abuse. Now to more positive things, right? Child protective factors. When we see good health of parents, children, when we see an easy temperament, positive disposition, active coping, positive self-esteem, these things, again, they don't cause a child to be safe. You can have a child that has a great temperament and they're still abused. But what the research indicates is just that correlation shows relationship. Oftentimes when a family is stable, then you see these temperament disposition variables. Good social skills, internal locus of control, and this just speaks to a child's understanding that they can determine their own course. A person with a external locus of control puts the responsibility somewhere else. Parents oftentimes model this in good systems. Okay, you didn't make me angry. Okay, I became angry and I'm sorry. The parents will oftentimes, in maltreating families, they will have an internal, they have a strong external locus of control, right? I hit my child because my child made me, they did this. You hear this inappropriate language in domestic violence. Well, you made me act out. You made me become violent. And we don't use that kind of language. It's not healthy. It's not healthful. It's not productive. Above average intelligence. These are protective factors. Good peer relationships. Secure attachments. So when parents have strong attachments with their strong friendships, and then also this helps the children to have strong relationships. Positive and warm parent-child relationships. The parent is secure, the adult attachment pattern. Parents support the child in times of stress. The household rules and structure, the parents monitor their children well. There's a history of adequate development and hobbies and interests. So we need to see that children who have a lot of healthy habits and strong interests, it protects them. These are protective factors. Also, middle class and upper class socioeconomic status. So this comes into play that when you are in college right now and you're thinking about dropping out, you need to think long term, because being middle class and being upper middle class is associated with child maltreatment. Obviously, there are wealthy families where children are abused, but what we're talking about is statistics. So the more education you have, the greater likelihood of your income will be middle class or above. And when middle class or above average income levels are in play, we see fewer children reported into the system for child maltreatment. Access to health care, consistent parental employment, adequate housing, a faith group, a religious community is also statistically to the advantage of children. Good schools, supportive adults outside the family, role models, and even mentors. A supportive and healthy extended family includes help with caregiving. So it kind of does help that a lot of students in Mississippi, as I say, oftentimes can have a spontaneous family reunion because they have a street that's named after their people. This is actually beneficial, and if you have a large community around you, then chances are that your mom had a sister or had an aunt or had a mother or a grandmother who could come pick you up from school if they had to work late. So in systems and families where you don't have this, it puts more strain on mom and therefore more strain on the child. Stable relationships between parents and husband and wife. Parents model competence and good coping skills. Family expectations of pro-social behavior help the children. So like we expect you to go to school. We expect you to go to practice and to do your job, and we expect you to work hard. And the higher the parental education, the better off. This is a good laying of a groundwork of where we will be. We will build on this base, looking at parental risk factors. And I look forward to hearing your responses of how this information settles in as you start to think about this. The difference between predisposition and predetermination, and how these risk factors can set children up for maltreatment down the road. Okay, I look forward to hearing what you have to say. Thanks.